By the way,
Yeah.
I don't know what you did,
Oh, darn it.
but tremendous improvement.
That's great. Right there was that's an entrapment test or a stress test on the capsule. And you can see Randy's face. That's still hurt. So next to the shoulder. And push hard. There you go. Head of the humerus. Traction and internally rotate.
That was excellent.
Yeah. We have Randy here. We're gonna do talk about his shoulder injury, and we're gonna go into a little bit more detail because this is a bit more of a complicated type of injury. What happened? Why don't you explain to us how you injured it first?
Not exactly sure when, but I do know the day. Started off my workout with bench press, and I went much too heavy, as usual. And then I continued after that with shoulder exercises. About an hour later, I started to feel the burn. And by the end of the workout, I couldn't even do a push-up.
Got it.
That was December 23rd or 22nd.
Go ahead.
So now we're in April, and it's not getting any better.
Now, how did it feel like 2 weeks after that happened? Was it feeling like it was getting better at that time?
Yeah, it did. And so I continued with my workouts, although I wasn't doing bench press. I would switch to flies and cables. I worked around the pain.
Got it.
But every week I heard it a little bit more, and the progress stopped.
And then now we fast forward to April, so December, January, February, March, April. I mean, it's been not 6 months, but definitely if it's not getting better now, it's not getting worse though at this point.
As of the adjustment on, was it Monday when I was here? I was here a few days ago. The improvement has been tenfold compared to what it's been over the months.
So which is great news. Let's back up and figure out what we found going on with your shoulder and how we came to that conclusion and what we did and what we're going to do today to pick up where we left off. Sound good?
Yes.
Okay. So we narrowed it down. There's essentially 3 basic layers of the shoulder. You got the big muscles, the small muscles, and the capsule, if we really just break it down to that. Now, the first test that we did on Randy to decipher what he actually injured, first off, show me how much range of motion you can do. I'm really glad you're doing a lot better, but also kind of bummed that we don't get to see how bad it was. So
wait,
sorry.
You did see how bad it was because I was here the week after I injured it, and you said, don't stretch it, just roll it out.
Yeah. What do I always say? You don't stretch an injury. I always say that, and then I said, okay, so
the people I work out with had other ideas on how to treat it.
I bet they did.
So right now my range of motion is really good.
Okay. Go this way right here. This way, thumb up, and go up as high as you can. Was there any pain in your restriction?
A tiny bit of pain.
Where did you feel it start?
Right there.
Okay. Wow, that's really good.
And
when
right
you internally,
there.
So that's what I wanted to do. See how that he internally rotates his arm and it starts to increase even at that same level. If I push this here,
there's the pain right there.
Right there.
Yeah.
Okay, so I didn't stretch a muscle. What I did right there was that's an entrapment test or a stress test on the capsule. And you can see Randy's face. That's still hurt. So when we really unveil that or isolate that, you can see a lot of the injury is in that deepest layer in the actual capsule. So we're gonna check one of the more superficial, bigger layers, the big muscles, the deltoid. Typically from bench press, the injury is gonna come from, it can be a strain on some of the bigger muscles like the deltoid. Not such a big muscle, but a really strong muscle is the Coracobrachialis, and then obviously the pecs, right? So when you internally rotate your thumb this way and push your wrist in right there, any pain on that?
A little bit.
Okay, where do you feel it?
Right in
deep
there.
In here. So
it's deep, yeah.
So that's a pec test. Now this pec feels stable to me. I don't feel like giving it all. So that is putting some type of strain or stress on the tendinous connection. Go ahead and relax there. You feel that as I open it up. That's not a tendon stretch. I mean, we're actually putting tension on the capsule. So the next step that we want to do is actually check that Coracobrachialis, which is gonna just internally rotate there and then push up Any pain on that guy?
Yes, lots.
Okay. Again, to me, that feels really stable. So the Coracobrachialis feels really stable, and yet it's causing him pain. How about the deltoid? Push up here.
Pain.
Pain. Again, to me, it feels really stable, but he's feeling that pain. So anytime we load the capsule, yeah, you feeling on the anterior portion?
Yes.
So based on, you can visualize if he's putting all this stress through a bench press, well, that's going to leverage the capsule forward. Can you visualize that? It'll push it forward. So if anything, part of the capsule that's going to get sprained or get these tears in that capsule, that'll be on the anterior or possibly the superior part of the capsule. And we push up here, right? And we felt that was painful.
Yes.
Now we're going to push forward and up this way against my hand. Any pain on that?
A little bit.
So interestingly, we kind of, what we did was kind of do like a bench press test. So that's an anterior delt isolated test. We pushed it up this way though, which isolates the anterior deltoid, and that did not affect it at all. And then right when we started
Yes.
clamp down and pinch down, so I can tell right now, if he's already clamping down on that capsule, then there's impingement there. It's not just an irritation of the capsule, it's an impingement. So two things are happening. One, or two possible things. One, that humerus is actually not in the right position. And two, in order for that to happen, it's either shifted out of the right position or the rotator cuff muscles are not anchoring it down the way that they're supposed to. So we're gonna go right into the rotator cuff muscles. And I'm starting with the infraspinatus. Go ahead and push back right here. Resist. Any pain on that one?
No.
No, that was good. Fantastic. Relax there. Okay, relax there. Is that painful?
No.
That's okay. Do you see that every time we go to relax there and just let the shoulder relax, the bigger neck muscles, have you been getting any neck pain at all? Okay.
No.
The bigger neck muscles are trying to protect that area. So like the levator scap, the trapezius is overcompensating for a weakened shoulder. Push your wrist out against my hand. Any pain there?
A little bit. Right in there.
We're leveraging right on the, again, the capsule, but that's a Teres Minor test, one of the other 4 rotator cuff muscles. And this is putting the capsule in a provocative position, but we're checking the subscapularis. Push down here. Any pain?
No.
Okay. It feels very strong to me and he doesn't feel much pain. So when we put it here, and we're really putting a lot of the torsion onto the superior part of the capsule. So it looks like the more the irritation is going on the anterior part. And then this is the most commonly irritated. This is going to be the supraspinatus. So we want the elbow perfectly straight. We don't want the bicep or the deltoid to kick in and try to recruit. By isolating the supraspinatus, we're going to keep it right at that first 30 degrees of abduction in a 45-degree angle here. So his thumb, if he was pointing his thumb, it'd be going out that way. Go ahead and push out against my hand. Hold, and
That's
relax.
painful.
It's painful, and I did not do a good job of isolating that supraspinatus because you were using the bicep there. So let's try that one more time. Push against my hand. And when I isolate it, that's actually working better this time though.
It is.
Last time that wasn't engaging much at all. That was just like a 3 out of 5 going down. Now it's a 4 out of 5 with pain. So the only area of true weakness is in that supraspinatus. Everything else is fairly strong. It just hurts the capsule. It puts too much leverage on that area and causes pain. So let's do one other test. I want to just see how the foundation, the upper back, and the neck are affecting the shoulder. So bring your chest up really high. Roll your shoulder back this way. Extend your elbow. So that would be flexion. So I want you to straighten out the elbow, in other words. And bring your shoulder down this way. Good. And now push your wrist out against my hand right there. Right there. All right.
Not much there.
Yeah, so what's happening there is we did a really good job of isolating the supraspinatus, and that's where it went right back down to that 3 out of 5. So there's still a lot of healing that has to take place in that area. Also notice that as soon as we put his shoulder in a correct position, things actually started not working right. So his body's still doing a lot of contracting or compensating to protect the area. One of the things that I like to do in this situation is make sure that his upper back and neck are working really well first. So we're gonna start there. All right with you, Randy?
Yeah.
All right, go ahead and relax his shoulders. So I'm going to, now it's absolutely necessary that you address the muscles of the shoulder. chiropractically speaking, we get the mechanics improved to the shoulder, the upper back, the neck, but if we don't address the actual local musculature issue, then this will not heal properly. So I'm gonna have you first off interlace your fingers behind your neck. One of the things that happens when the scapula or the shoulder gets irritated, the scapula gets hung up on the ribs more. So I'm gonna have you bring your arms down here. Good. And just go ahead and lie down there, I got you. And relax the shoulder. There you go. Ah, that feels good.
Indeed.
Very nice. Lie on your back at the top of the table. C5 vertebra of the neck, that's all the innervation that goes to all four rotator cuff muscles, including the deltoid. That's the most important neurological structural area for that shoulder. So we want to make sure that that's gliding and moving and have good integrity there. Okay, let that go. Perfect. Woo! How'd that feel?
Nice.
Yeah, that's pretty good. And then C5 right there. Perfect. Smooth. Okay. Now what we're going to do is we're going to set that GH joint. It's a pretty gentle adjustment here. Just relax, drop the arm. I want to feel the full weight in my hand. We're going to pin down the head of the humerus, traction, and internally rotate. Good. No hang-ups there?
Mm-hmm.
Awesome. And then take a deep breath in. Okay. And relax that. Okay, go ahead and have a seat at the bottom of the table. I'm gonna have you scoot this way a little bit more. There you go. Okay, so we know we have problems with the supraspinatus. Feel that twingy spot right there. The supraspinatus is a muscle that goes all the way back in the upper part of the spine of the scapula, which is why they call it the supraspinatus, but it travels underneath and through to the head of the humerus, so it's a bit tricky to find. Push your wrist up against my hand and relax. Try not to use that bicep, so push.
Oh, using...
Yeah, there you go, yeah. And then relax there. Okay, so just at the tip of the acromion process on the head of the humerus, what I'm gonna have you do now, I got a good grasp on that. You're gonna, with your thumb up, you're gonna bring this down. And we did this last time, this worked really nice. Internally rotate, extend your elbow, bring your chest up, take a deep breath, and relax. Nice, okay, go ahead and relax that. It's a good release there. Now, we're gonna get on that capsule. So to bypass all the musculature, I just need you to relax the shoulder as much as you can. Just let that go. More tender there, or more tender?
It feels
like a good knife.
Yeah, there it is.
Okay.
That's equally tender.
Yeah. Okay, I'm gonna have you take this wrist and you're gonna pull it. Now that we've got the capsule dropped in nicely, we can externally rotate it and just clear out some of those adhesions. So you can do that same thing, but push against my wrist right there.
Okay.
Ooh, yeah. You'll feel some of that crepitus. It's just like rust coming out of the shoulder. And then now this one we're gonna do under resistance. Okay, how's that feel?
A little painful,
Yeah,
but good.
it's all right. Hurt so good, right?
Yeah.
Put your hand on your wrist there. Your your hand on your hip there. You knew what I meant, right?
Yeah.
We're gonna anchor the scapula, and this is a really good isometric adjustment of the rotator cuff muscles. You're going to push your elbow back against my hand. Push hard. There it goes. Nice. Okay, shake it out.
That was excellent.
Yeah, I thought
Very
so.
good.
That was good, right?
Right.
Okay, which of the exercises I gave, which one did you like the best? You remember?
They're all amazing.
Yeah. You remember this one?
Y-
Can you
yes.
give me a couple of those? Just your
Yeah,
fingers go
yeah.
around your ears. So this is a good way to, we're not doing it, putting too much stress on the capsule, but we're activating the heck out of the rotator cuffs, but mostly the big muscles that support it. So it's a good way to activate those muscles without stretching, taking them through the full range of motion. Super good. You just want to be careful of the neck, so keep your chin a little bit more neutral. Nice. And you can see it's a workout. It's not a stretch, it's an exercise. Go ahead and drop your hands down. Shake it out. Feels tired?
No, not yet.
Not too okay.
I've been doing the exercises, so
good,
I'm
man.
building up some strength.
Compliant patients get better results, see?
Indeed.
All right, so this is the big test right here. Hold that right there. 'Cause remember, we're gonna try not to compensate. We wanna make sure that that supraspinatus and that capsule is in a much more comfortable position. So keep that elbow straight and push that against my hand right there. Push that.
Out.
Remember the
Okay.
45-degree angle right there. Push, hold, and relax. Okay.
It's still pretty painful.
Still pretty sore.
It's not bad. I would put it at about a 4.
So in the last 3 days overall, what percentage of improvement would you say?
It's been significant.
Okay,
I
I'll take
would
significant.
I'll put it at about 50%.
Right on.
It's
After,
almost
you know,
unreal.
5 months. Okay.
Yeah.
Good for you. Okay. Just keep working those exercises, and yeah, when it's in good place, all the lights are turned on. It's just a matter of time and repetition. So, cool.
Thank you.
Yeah.
Thank you.